What happens when a teenage girl becomes pregnant? Is she prepared physically, socially, psychologically? What is the society doing about this issue to prevent it from occurring? Today, we are going to discuss teenage pregnancy, its causes, consequences, and prevention. We are honored to have and also host distinguished professionals from the Ga East Municipal Hospital. On my extreme right is our DDN nurse. She is the Deputy Director of Nursing Services, DD Evelyn Doku. To my left, I have Nana Kunedu Redu. She is the antenatal clinic in charge. And to my extreme left is Mr. Samuel Riafi, the clinical psychologist. You are all welcome panelists.
Thank you.
Thank you.
I am Abigail Ansan Samuel, your adolescent cancer advocate. We are starting the program. So if you are joining us, do well to like and subscribe to this channel. Okay, Didi, I want to find out something from you. Why is teenage pregnancy considered a significant public health interest in our environment where we find ourselves?
Okay, good morning all, and thank you very much for the opportunity. So teenage pregnancy is a public health concern globally, as well as in Ghana. So statistically, we realize that the teenagers form about 35.4% of the population, and then 50% of them normally drop out of school as a result of teenage pregnancy, meaning that it affects both the nation, it affects families, and it also affects the individual who become pregnant as a teenager. It affects them in several ways, considering their psychological, their social, economical, and their reproductive health as well.
Well, thank you so much for this insightful explanation and then ways. So let me take this from Nana Kunedu. Nana, from your experience at the antenatal clinic, what are some of the challenges teenage mothers face during pregnancy?
Thank you very much for the opportunity. The teenage girls, when they come to antenatal, when they come, they have the fear of the unknown, because the pregnancy alone brings a lot of emotional stress. So when they come, they don't know what is going to happen to them in life. So they are confused emotionally and psychologically. And then they have a lot of challenges because their body is not well developed to carry the pregnancy through. So whatever is happening in their bodies, they are confused about it. They don't know how they are going to carry it on. They have financial support, the financial problems, because pregnancy itself has a lot of things that you have to acquire before you are able to go through pregnancy and childbirth. So they come, and the labs that they are supposed to do, the medications and things, there's no money for them. So they are confused in life.
Wow. Well, thank you so much. So if you're not joining or watching us, this is the Adolescent Cancer channel. Do well to like, share, and subscribe. If you have any question concerning teenage pregnancy, do well to drop your question in the comment section. Our panelists are here to support and give us more insight about the questions we will ask. So now let us take it from the psychological point of view. So Mr. Riafi, I want to find out this turn from you. What emotional impact does teenage pregnancy have on the adolescents?
Yeah, thank you very much for the opportunity, Abby. And you see, the adolescent stage is a stage where it's more like a transitional stage. It's a time where, for us psychologists, people are trying to identify themselves. They are trying to a failure in that development means that there's going to be what we call role confusion. And so when the pregnancy happens, it disrupts that natural development, that process of them being able to identify themselves. And this shifts them into taking on certain roles that they are not mentally prepared for. The role of a mother, the role of parenting, and all of those other situations that come before them. So seeing many teenage girls who have been pregnant, what we usually encounter is that usually may come with some shame, some guilt. They may feel that they have disappointed their relatives. Some of them got pregnant because they were just exploring, and then unprepared, they got into the situation. Their parents and other people may be angry at them. There's a lot of shame that goes on, as I've mentioned earlier. And so it puts a lot of emotional toll on them, comorbid with having to cope with the hormonal changes that comes with the pregnancy itself, as well as the anticipation of what would happen. And that's what my colleague just mentioned, the fear of the unknown that would come in. So that also stands out because they don't know what is going to happen. Usually they don't have support, many of them. It's just few who really have support. If you assess, many of the people who get into those situations are usually also vulnerable children. They already may have gone through it because they were also in a need of something, and that also leads them. So they are also dealing with all of those additional socio-economic situations that pre-existed, and now the pregnancy comes to add on to it. So there's a lot that goes on emotionally and psychologically.
Wow, thank you so much for this insightful explanation. So back to Nana Konedu, I want to find out something. So what are some of the complications this faced by the adolescents or teenage pregnant mothers?
Okay, thank you. So just as the psychologist spoke about, the teenager is now going through developmental stages, and then pregnancy comes in. So the body of the teenager is not well developed and prepared for the pregnancy. So sometimes they get into preterm labor, because as the pregnancy is growing, the abdomen is expanding, and it expands to a stage that it cannot further expand. And baby had not grown to the full stage that baby has to come out, but the body will just repel the baby. So the the mother can go through preterm labor. When they go through preterm labor, they are going to have small babies, because the baby too is not matured to survive in this world. So sometimes you have to send baby to NICU to keep them in the incubator, and sometimes they even lose them. They can also have intrauterine death. The baby can even die in utero, because the mother's body is not well nourished to keep the baby till term. So sometimes they lose the baby inside before the baby is born. So those are some of the complications. Sometimes they also develop high BPs, which may lead to preeclampsia or even eclampsia. That will put the mother at a very high risk. The kidneys of the mother can be affected, and future complications and other things. And then they go through birth, and sometimes they have what we call PPH. The mother after delivery may bleed profusely. So that one too is another cause. They also face the challenge of anemia, that is low blood levels in pregnancy. So because the mother's blood is not enough, the nutrients and the oxygen saturation for the baby is not enough for the baby to survive. So it puts them at a very high risk in pregnancy.
Wow, wow. I hope you're learning something. If you're not joining this channel, do what to share to another adolescent. And if you're an adolescent, medications that are associated with teenage pregnancy, we need to abstain. Do what to like, share, and then add your questions in the comment section. We are prepared to answer you. Now let us go back to Didi. I think a question just dropped in. Somebody asked that she wants to find out how prevalent is teenage pregnancy within our municipality.
Thank you very much for the question. So within Ga East Municipality, there is no readily available data. Although a study was done in La Quintana, and they realized that they recorded a percentage of adolescents. But in 2020, Greater Accra recorded more than 109,000 adolescents who got pregnant. So the prevalence of teenage pregnancy it really exists in Ga East, just that the data is not readily available. Yes, but we have some that even comes to Ga East Municipal Hospital for their services.
Thank you so much, Didi. Thank you so much. I believe you heard what the statistics that was given in 2020 to thereabout is so huge. So let us abstain and stay safe. So I'm going back to the psychologist, Mr. Riafi. How does stigma and community gossip affect a pregnant teenager's mental health?
Yeah, stigma plays a huge role
Yeah.
in how they cope, uh, in terms of the community acceptance, in terms of the support they receive, in terms of how they even, because already they are feeling guilty. Many of them are already feeling guilty for getting pregnant at a very younger age. But you have the situation where the community also tries to punish them further by making them feel ostracized or feel not like the bad child, quote unquote, or in that sense. And so it makes it extremely difficult for them. It really leads to all kinds of mental health situations, including depression. Suicide is one of those things that comes up a lot. If you ever talk to the teenagers, you would have heard that they might have contemplated or thought of ending their lives because they got pregnant. And so that is one of the things that comes up a lot. And associated anxieties and situations. And there's a lot of psychosocial stress. Sometimes they might have gotten pregnant with a fellow teenager who is not working and might deny the pregnancy. And it can be very, very challenging. Or they may have even gotten pregnant with an adult who equally abscond. I've seen a lot of cases where the man had, we can't find the man. And then there have been some cases where the only name they know is maybe the man is called Kofi. And in the community there are a lot of Kofis. So it can be challenging that you are carrying a baby and you don't even know or able to identify the father. And so it's been in weird instances that people actually get pregnant, and the society also lambasting them makes it even more difficult for them.
Wow. Thank you so much. Thank you so much. So I'll go back to Didi. Didi, what role do parents and guidance play in preventing teenage pregnancy?
Thank you very much for your question. So we have the responsibility as parents and guardians to guide our children, the adolescents, be it a boy or a girl. And one way by which we can do that is by educating them on sex education. This is one thing that is normally not done in our homes because some parents even don't have that confidence to educate their children. But it is our responsibility as guardians to guide them, educate them in sex education. And we also need to support them psychologically. When they have concerns or they have questions and they come to us, we must be open to them. We shouldn't hide anything from them. And then economically too, we need support them. I know some of the children are coming from low-income homes. So sometimes they have issues with funds for their upkeep. For example, when it comes to money, or even sometimes dresses to wear, or even food to eat. So they end up being influenced by people who have money, especially elderly men and even younger people who have money. And then because of that, they are being influenced and they give them money. And because of that, they try to follow them, and then they end up becoming pregnant when they have a relationship with them. And also as a community, we have also a responsibility to support adolescents within the community by supporting them both financially and then giving them education as well, like we are doing in Ga East Municipal Hospital. So fortunately, Ga East Municipal Hospital, we have an adolescent-friendly services that we provide for all the adolescents that come to our facility. So we take them through sex education, through other forms of education that will empower them as adolescents so that they will not find themselves victims in this situation.
Yeah.
Thank you.
Thank you so much, Didi. Okay, so I'll go back to Nana Kunedu. Nana, why is early and regular antenatal attendance important for a teenage mother?
Thank you once again. Early antenatal care is very important to the teenage mother because when they report early, we are able to triage them, and then we are able to pick the risk and educate them so that they don't fall into complications. Because if they stay home and they come late, most of the things that we identify that is contraindicated to the pregnancy, we may not be able to correct it before they go through labor. So it's very important that, just as Mami said, when the family or the mother, whoever realizes the girl is pregnant, they should not shun the girl. They should draw them very close to them, teach them the things that they are supposed to do, even personal hygiene, how to keep themselves as a pregnant girl. Because when pregnancy itself brings the body a lot of hormonal changes. So if the girl is not taught how to take very good care of herself, she's going to develop infections that may lead to complications that will affect the pregnancy. So we want them to come to antenatal early so that they are well informed, because they lack knowledge about the pregnancy. We'll take them through the stages of pregnancy, what to expect, so that when it's happening to them, they will not be confused. They will understand the stage in which they are in, so that they will be able to accept it, and then they'll go through the pregnancy successfully. So we also, when they come, we also link them to the social workers, so that during the pregnancy they are supported and encouraged so they can continue with their lives.
Wow, thank you so much. As I said, this is Adolescent Corner channel. If you're now joining, do what to like, subscribe, and share to other adolescents. Okay, I think Jojo sent a question. He says that what practical steps can families and communities take to reduce teenage pregnancy? So Didi, can you help us with this question from one of our viewers who just sent it in?
Okay, thank you very much once again. So as I have mentioned already,
Yeah.
for Ga East Municipal Hospital, we have adolescent-friendly corner there that we offer adolescent-friendly services to our clients, especially the pregnant ones who come to the facility. So these are some of the things that we can encourage the children who are pregnant. If it happens to them, they should come to the unit and they will be given the support. And then we as parents, we are supposed to support them. In case they get pregnant, we are supposed to support them by educating them as to what is expected of them, encouraging them that that is not the end of the world. After pregnancy, when they give birth, they can still continue with whatever they want to pursue in life. They can continue with their education and their future career. And as a community too, when we support the adolescents within the community, is to prevent the stigma, because there is a lot of stigma associated with teenage pregnancy. So when we support them, maybe by providing some of their needs for them, and then they get into the society, they will even help to educate the younger ones so that they will also not get pregnant and then become victims of adolescents, teenage pregnancy.
Wow,
Very
thank you
much.
so much. So the family, the community, the society, we all have a role to play to support our teenagers. Okay, so I think once somebody also sent a question, says, what guidance would you give to adolescents regarding healthy relationship and decision making? So Mr. Riafi, can you help us?
Yeah, thank you very much. As I said, the stage is it's a confused stage.
Yes.
And this is the time people identify themselves. There's a stage, there's an attraction for the opposite sex. There's a stage where one's sense of identity is even tied to how well the opposite sex appraises or approaches them and what words they say to them. It's a very funny stage.
That's true.
But it also means that, as Didi and has already mentioned, this is the time parents have to get closer.
Yeah.
Many parents are so busy that they neglect the children to navigate this phase alone. And it doesn't help. They'll be able to guide them if they are having some friendships. They'll be able to open up to them and let them know so that they can provide them the necessary information and tools to go about those kinds of friendships. At that stage, it is good to define the friendships that you have, and if it is getting into, my suggestion would be to abstain. Okay, at that stage, that is the most,
Yes.
the best
Yes.
recommendation. However, in some cases, some people find themselves in a situation where it gets very complicated and it's difficult to abstain. So we need to, parents are the first points that the first responsibility is to the parents. However, the society also can help when they identify certain habits and behaviors that are inappropriate. They can draw the attention of the parents or intervene early so that it doesn't lead to the pregnancy. Sometimes from the public health unit to, maybe we have to start educating some of the parents on if you think your child is not compliant with some directives, maybe some family planning might be helpful to avoid some of these situations. Can be very useful as well.
Thank you so much. So as rightly Mr. Yafi said, abstinence is the key. So we are pushing abstinence, agenda abstinence to all adolescents. Okay, I think we have a scenario. Let's look at this scenario, then we end today's section. A 16-year-old girl becomes pregnant. Her parents are disappointed. The partner denies responsibility, and she's afraid to attend the hospital. What should be the immediate steps taken? So Nana Konedu, what should be the immediate step that we will advise? Oh,
So the immediate step is the parents supporting the girl child who has become pregnant. She cannot go through alone. We all make mistakes. So we should accept her so that we'll assist her and bring her ourselves. The parents should bring the girl child to the facility. So when they come, like the adolescent corner, they'll be directed there. They'll take them through before even the antenatal is initiated, so that the girl child doesn't go through all this stress alone. So that whatever the girl was doing, if she was in school or learning a trade, she can, after the delivery, she can go and continue. But if you leave her in this condition, then her life is going to be a mess, and the problem is going to come back to you as the parent, which will also affect the community and the nation and the world at large. So the first step is that the parents should get involved in the care of the pregnant girl and bring the girl back. If the parents are not doing so and they have neglected her, she can as well walk to us, Ga East Municipal Hospital, the adolescent corner. Then we'll have a chat and we'll pick it from there.
Thank you so much. Mr. Yafi, so what are some of the steps that we can also take considering this scenario?
Yeah, so being a psychologist, my first recommendation would be to work on the acceptance of the family. Because they are disappointed. And their disappointment is valid, feeling they have. And we need to walk them through to come to accept that reality that their child is pregnant and there's little they can do about that. And also when that is worked on, then we know that there's going to be significant support for the girl. And then through that they can come to the hospital and get the needed support. And it's easy to push away the feelings of the parents as if it doesn't matter, but after making all your investments and it ends that way, it can be very, very disappointing. So we have to help the parents to navigate that phase. And if they, and as Nana has mentioned, yes, if there are no support systems, we have the social welfare, we have other systems in the community that can identify someone who is in need and should be able to help deal with the fear and the stigma and from the girl's perspective and bring her to the healthcare facility where we'll take care of the rest of the care from there.
Thank you so much. Okay, Didi, last words from the family and community intervention. What can they do concerning this lady's issue?
Okay, thank you very much once again. So there are NGOs who also support adolescents. I think for Ga East we have ACT Foundation, which is located at Hacho. They support everyone, including adolescents or teenagers who have issues. They support them financially. Sometimes they even provide accommodation for
Wow.
them. So with that, we can also fall on them for support. And then, like the community, we have opinion leaders within the community who can also support the children in one way or the other. Thank you.
Thank you so much. This is the Adolescent Kana channel. Before we close, I would like my panelists to give us their final words as a caution and as advice to all adolescents, parents, and community members. So, Didi, let's start from you.
Okay, so my final recommendation to all adolescents or to all teenagers is that they should try as much as possible not to engage themselves in illicit relationships. If they enter into a relationship, if it becomes necessary and they enter into a relationship, at least they should talk to somebody. They should talk to their parents. They can talk to any names. They can come to adolescents corner and talk to somebody for advice so that they will not engage themselves like our psychologists mentioned, they shouldn't engage themselves in sex. But even if it becomes necessary and they have to, at least we can advise them. They will have a family planning unit. They can come to the family planning unit and they will be given contraceptives to use. The abstinence is the best, like he mentioned, but there are situations that you cannot have control over. So they will be provided with the contraceptive so that they will be able to continue with their education. And then the open discussion on sex education is also very key. That can be done in the schools. We have school health services in the school. So the school can also support, or the school nurse can also support the adolescents in that manner.
Thank you so much. Nana Kennedy, your last word.
So what I want to tell the adolescents is that they have their whole life ahead of them to lead. So they should not rush in making too many mistakes. This is the time your books should be your friend. Study. Bible even says that we should study to show ourselves approved. So whatever course that you are taking, let your books be your friend. Study so that you will find a better place in life. And when the mistakes come, we are ever ready to listen to you. Talk to your parent. Talk to whoever is close to you. Your peers may not give you a very good advice because they themselves are also going to. They may even lure you into certain things that will bring you a lot of problems. So please, the adolescent, when you are in the church, wherever you are, engage yourselves in the things that the youth is doing so that you find something doing that will keep you active so that in future you not regret the decisions that you took. Thank you very much.
Thank you so much. Mr. Riafi, your last word to the
Yeah,
adolescent.
thank you very much. I will speak to a small proportion of the population that we really didn't talk about, that are those that are abused
Abuse.
and they get pregnant.
Yeah.
They are either raped or get into some abusive situations that ends up. And because of the abuse, they are not able to even seek help or talk to somebody about. And so I will encourage those populations to learn to speak up, open up, because sometimes if the incident has happened within some time, there are some contraceptives and other things you can take to prevent the pregnancy in the first place that could be administered, and then their pregnancy will not even happen in the first place for it to lead to become a teenage pregnancy. And I would encourage the young girls to also get closer to their authorities in their lives. In school, you have teachers. In church, you have other people. In your community, you have other leaders. And all of those. They are all very useful resources available to them. They should try and open up. If you have engaged in an unprotected sex, you have to be able to talk to someone about it. That, I mistakenly got myself involved in A, B, C, D. And then they can guide you properly. In that way, we can prevent. I am more for the preventives than having to deal with the complications that comes with it. Because navigating adolescence is in itself stressful. Adding on another role of parenting an unborn baby and later parenting a child, it doesn't come easy. From where we work, even people who have had multiple children still get stressed in pregnancy and develop a lot of postpartum complications. So how much more an adolescent who is not mentally ready, who is not physically ready, financially ready, socially ready. We are talking a lot about mental health complications. So my advice is that we should move towards more of the preventives, and then if in case the incident happens, we can still administer some intervention to prevent the pregnancy. But in case it happens too, they should communicate early so that and seek help early. Thank you.
Thank you so much. This is the Adolescent channel. Teenage pregnancy is not an individual activity or issue. It is a public health issue because it affects education, financially, society, communities where we find ourselves, the stigma attached to it. Prevention is the key. We can prevent it through encouraging sex education, through encouraging our adolescents to stick and then to positive peer group influences. We can encourage our adolescents to also partake in all adolescent-friendly kindness in our facilities and our communities where we find ourselves. If this discussion has been beneficial to you, do well to like, share, comment, and then always be in tune for your Adolescent channel. Thank you. Stay blessed. Bye.
Bye.